All right, good evening and welcome back to Nite Line. If
Welcome.
you're just joining us after church, we're so glad that you're dialed in this evening. We got an incredible show for you this evening, but who are these people, right? Well, we're Rick and Tanya Curren of Boundless Limits, but maybe you know us as those crazy snake chasers on Scaly Adventures. And we're actually a family that does a TV show called Scaly Adventures that's actually aired right here on the air on WGGS on Thursdays at 4 o'clock. So if you're ever interested in checking out what we do when we're not doing this, you're along for a wild ride. But again, we're Rick and Tanya Curren, and we're just so glad that you're here with us this evening. I do want to remind you first out of the box, a couple of things. First of all, this is a call-in ministry. Feel free to call in throughout the evening. Nobody's going to ask you for money. We just want to find out, how can we pray for you, or how can we celebrate with you, because we know that God is doing miraculous things in your life, and we want to encourage you. If you're dealing with something, sometimes it just feels so good to speak and get it out. The second thing I do want to open with this, and this is maybe a little bit different than you've heard on WGGS, but tonight's topic is probably one you're going to want to put the kids in the other room for. It's because we're going to be talking about marriage and intimacy. If you joined us in the first hour, we talked about adultery and some things that were probably adult issues as it was, but this time we're going to talk about more the physical side of things and why it is that sometimes marriages have difficulties in the later part of their years. Tanya?
Yeah, I think this is going to be a great hour. It's very cohesive with our first hour. We were talking about relationships, and now we're talking about the physical side, but also the relationship issues that come with that. And we've seen this happen with people that we know, and it's kind of awkward to talk about. A lot of people don't talk about it. You don't really talk about it at church. So then sometimes with your friends, you don't really talk about it. So this was a neat forum for us to bring on our guests, who we'll introduce to you in just a minute, for you to talk about this in a safe place and hear about it. And Rick has worked with him, and so he's very knowledgeable in this subject as well, and Dr. Monroe is our expert tonight, so you're really going to enjoy this second hour. Before we go to our music with Rachel Rizzuti, who is just so beautiful on the inside and out, she's really been blessing us throughout the first hour, and she's joining us for this entire second hour. I want to encourage you with something that I read. One of our wonderful friends, Howard Edson, gave us this book. It's called Morning and Evening by Charles Spurgeon. This really encouraged me the other day when I was trying to pay the bills and things were tight. And so if this relates to you, I just hope that this encourages you tonight. He wrote, when a man gives a promissory note, his honor is engaged. He signs his hand, and he must discharge it when the due time comes, or else he loses credit. It shall never be said that God dishonors his bills. The credit of the Most High never was impeached, and never shall it be. He is punctual to the moment. He is never before his time, but he is never behind it. Remember that God is punctual to the moment in your life. He's never early, but he's never, ever late, and he loves you more than you can fathom. Now be encouraged and blessed by music by Rachel Rizzuti, and she is singing Have Thine Own Way.
Have thine own
You're enjoying music by Rachel Rizzuti. We encourage you to get her CD. You can go to rachelrizzutimusic.com. And Rick and I were just sitting here listening to her, and you said she's got such a sweet personality and a spirit about her, and you can hear that in her music. It's very sweet and innocent and beautiful, and we know that's blessing you tonight. We encourage you to call in throughout the rest of this hour. That number is at the bottom of your screen. It's 244-1616. Especially if you have a question for our guest, Dr. Monroe. We would love to answer your questions live. We have these wonderful prayer partners who are so faithful to come every single night. They're here to pray with you, and so we're a ministry first. We care about you, so please feel free to call in throughout this next hour. We would love to hear from you.
Absolutely. Well, a little bit about our guest before I introduce him. Some of you may or may not know my story to get into ministry. It's not, oh, I went to college, I went to seminary, and now here I am running a church. None of those things happened. I had actually been laid off from a $200,000 a year job. And during that period of time, God had been really just laying on my heart to do something different with my life. And so at the time that I left that job, the same day, literally, the person I was working for before had said, hey, can you continue on in this capacity? And what I did was I worked for a medical device company, and a lot of times you may or may not know this, but when you go into surgery, if you're having things put into your body, then what happens is there's a representative from the company who is an expert in that device, who's there to help the doctor who's the expert in the procedure to make sure that you have the best outcome. And I was the cat that did that. And I now do that on a part-time basis. So I still am very frequently in and out of hospitals all over. I'm driving to Duke tonight to be at several cases in the morning. So I know to what I'm speaking about tonight when we talk about this. And it's such a great privilege with me to have this gentleman with me this evening. I know a lot of doctors, and I'm friends with a lot of them, but I am particularly fond of our guest this evening. I consider him a personal friend, so much so that I asked, when my father asked me who should be his physician, my father drove up here from Florida to actually be under Dr. Monroe's care. It's my privilege this evening to introduce you to what I think is one of the best qualified urologists in the upstate here, Dr. Robert Monroe of Palmetto Greenville Urology.
Welcome.
Thanks, Rick.
Privileged to have you with us tonight.
Appreciate that.
And again, thank you so much for your time. I know, having worked with physicians for over 20 years now, that you get about this much personal time. They never show, like you were saying, the finance meeting, I was saying, they never show that cool stuff on Grey's Anatomy. It's, life-saving, but there's a lot of paperwork and stuff.
There is.
So I just really want to thank you this evening for coming on the set, being away from your family, to talk about a real important issue. In our first hour, we talked with two women who had both been touched by adultery. One was the wife of an adulterous spouse, and the other was the woman who actually was in an affair. Not the same affair with that same woman. I always want to clarify that. But when we lined up those guests at the same time, I thought, what a great opportunity to talk about, knowing the demographic of this station, that a lot of our viewers are in their 40s, 50s, 60s, and even beyond, that intimacy and the issues that affect it really don't end at that age. And I thought it would be great to have you to come on, because I think a lot of people, when they experience marital problems, they go to talk to their pastor, they go to talk to their counselor, but a lot of times they end up talking to a guy like you, their physician, or they should consider it, wouldn't you say?
I'd say so. I mean, as a urologist, we deal with diseases of the kidneys, genital system, especially in men. So I treat a lot of males, especially with what we call erectile dysfunction, trouble performing sexually. I was talking to you earlier. I think we see younger and younger men coming in, and people in their 40s and 50s, especially males, that have a condition or a problem with what they consider a problem in their sexual performance. It could either be a lack of desire, or a lack of not being able to maintain an erection, or some kind of problem with erection, curvature or pain.
Right.
And we were talking about, you were talking about older people, but I think we see it a lot in younger people in their 40s and 50s. I always tell my patients that erectile dysfunction, sometimes that's the only reason they come see the doctor. Some people just think everything's clicking along. It's like you drive your car and never take it in until you hear that ticking noise. Well, that's the way erectile dysfunction is. A lot of men are just loving life and they're going along. all of a sudden they have a little issue.
Sure.
And erectile dysfunction is basically lack of blood flow to the male penis when they need blood in it.
Right.
And it actually can be a very early sign of a systemic or general problem with their health or cardiovascular problem.
Is it also, I have a question, stress? I mean, and those environmental factors like relationship issues, do you see in your practice people telling you, the reason I'm having this is because I'm having problems paying my bills, or I'm fighting with my wife, those kinds of things?
I can pick up on that sometimes.
Yeah.
And sometimes there's a lack of desire in the other spouse,
Sure.
or there's a relationship problem, or maybe there's some guilt over something. And certainly younger people can have anxiety. It's what I call performance anxiety.
Right.
And it's like a fear of public speaking. You get up there and your heart starts beating. It's really hard for a man to function like that because it's such an active role when they're panicky. So it is definitely something that can come from a relationship problem, or it can cause a relationship problem to become worse. There's no doubt.
Right.
It seems like in the experience that I've had in talking with physicians, both urologists and gynecologists, that there are certain issues that will erupt in a marriage, in particular outside of the stresses, but like the physicalities sometimes. I know I've talked to people before and they're like, well, my wife just doesn't seem like she's interested in me physically anymore. And, you know, I've talked to gynecologists, and you've treated prolapse before, even as a urologist, and that condition can be painful. So it can actually become painful for the wife to enjoy intimacy with her husband. And then likewise, like you were saying, with the other side of the coin about men having an issue with, you know, being afraid to engage, if you will. Can you speak a little bit about that?
Well, I mean, almost any sexual problem can be treated, whether it's a male or female. And it is certainly counseling. If there is a relationship problem, you just got to at least consider doing it.
Address it, yeah.
Right.
Exactly. A lot of times, I don't really go into it. People have come in to see me, and they've sort of just written off sex with their spouse. It's something they just have their relationship is entered a terrain to where they don't talk about it. A lot of men have had so much trouble with it. I don't know how it was. Maybe their spouse, they picked up on their spouse not liking it. There are sometimes when I see couples where the women are not very charitable to the guy. It's not forgiving, I guess, would be a good way of doing it. They're not very understanding, which is sort of hard.
Which puts more pressure back on the man.
And so it makes the guy never even want to try again.
Of course.
It's
Well,
like a child who has been yelled at.
Exactly.
And they just say, I'm not going to do that. I'm not going to put myself through that again.
Right.
Yeah.
And so some men, on the other hand, they decide to be more active, and they come see us and say they don't really care why they have it. They just want They want to get an erection. They want to come home and say, look what I bought today. It's like going to Kmart. I got it fixed today.
I got it fixed.
That's what they want. But they don't really, a lot of men are like that. You know, men don't really share what's going on in their minds a lot. And that is really very common. And I was reminded of that old book about men from Mars, women from Venus. Women will talk to you all day about their relationship problems, but men are they just want to fix it.
Yes, that's true. You have a saying about the 6 inches of the trip over.
Well, I've said for years that it's interesting when you're talking with women versus men, that women, they will take their issues, their stress and their pain, and they bury it about 6 inches under the ground and then trip over it and wonder why they keep tripping over it. And men, they'll bury their garbage 6 feet underground and then wonder why nothing ever grows there. You know, I've been to marriage conferences before where she's over there and he's over there. Just can't. 2 more days and I'm done.
It's like, you're not through yet. I'm in here 5 minutes.
Exactly.
But it just seems like. Let me ask you this: do you find yourself a lot of times visiting or counseling couples, if you will, or do the vast majority of your patients come in by themselves?
No, I see couples occasionally, and a lot of. I'd say it's about. Probably half and half. I don't really have, I don't know if it's my role to just ask them, you know, how many ladies are you having sex with? I don't really go into that.
Right.
Sometimes if I think if the guy tells me that it is a marital problem, sometimes we do. What I do see a lot are men who've lost their wife through death, and they'll grieve, and then they'll decide, hey, I'm still alive, I need to renew. And we get a lot of those, and men come in and say, my wife was sick for 10 years, and we never had relations. What can you help me out with? And that's a little bit of a challenge, but it's something we do a lot of.
I was going to say, I'm often struck by that, because we'll be in the operating room or something like that, and you'll say, yeah, this is a gentleman who's, you know, whose wife passed away like 5 or 6 years ago, and you know, and now he has a new girlfriend, and so suddenly things have. And it's interesting how sometimes that relationship, it may take a few years, but then the man will come in and address that issue as well, because, you know, maybe the partner says, I really want this aspect of our relationship.
And a lot of times the woman has lost her partner, and it's good to have a role in helping a new relationship to flower like that.
Sure.
So we help with that as well.
Do you see mostly men, or do women come in to see you for different procedures or issues?
I think, you know, one of the things that we see with women also is urinary incontinence, and that can be fixed either through exercise, medication, or surgery. There's an operation to fix female stress incontinence that can be done as an outpatient usually, but a lot of times there are things that go along with that, such as vaginal prolapse and some things like that, and that can lead to pain with intercourse. We call that's a term called dyspareunia, which is painful intercourse for a woman. That's very common, and that is, there are a lot of things that can cause that, so you need a full exam, but that can definitely be treated. Men do suffer from pain as well. They can have, there's something called Peyronie's disease, which is a type of scar tissue that causes painful or curved erections, and we treat that as well.
It seems like those things would be definitely barriers to intimacy, and I'm sure that you've probably seen where marriages have suffered. I mean, have you had that long-term patient before where you knew them when they were, you know, having kids, and now, you know, now they're kind of getting into the retirement age, and you've seen that relationship change as a result of that?
Yeah, sometimes. I see mostly men, I think, for this problem, so I'm kind of telling you where my practice is there, but I do see, I don't see very men who tell me my wife wants to have too much sex.
Right. I've never met a man ever who said that.
It's usually the other way around, and a lot of it is due to, I think, I see a discrepancy sometimes as people age and how each member of the marriage takes care of themselves, or maybe has a significant health problem. There are some people who have good habits and they eat right and exercise, and those are the people that you would hope might live a long time. And then you might have another member of the couple that gets sick sort of early, and that kind of wrecks the sex life a lot of times.
I was actually visiting your website today. It's greenville-urology.com.
Correct.
Is that correct?
Yes.
Okay, so if you visit Greenville and then the -urology.com, you can check out their website so that you can connect with Dr. Monroe as well, because again, we highly, highly recommend him. But on your website, you had something, it was a statistic about smoking, even about with bladder cancer, right?
Yeah.
So we can even, when we come back from our music, we can talk more about that. When you're saying like the habits and the health, that can affect something that can then affect your relationships and your intimacy and of course your physical health. So perfect. We're going to continue talking with Dr. Monroe when we come back from Rachel Rizzuti. She is now singing Let It Go.
White on the mountain tonight, not a footprint to be seen. A kingdom of isolation, and it looks like I'm the queen. The wind is howling. couldn't keep it in. Heaven knows I tried. Don't let them in, don't let them see. Be the good girl you always have to be. Conceal, don't feel, don't let them know. Well, now they know. Let it go, let it go. Can't hold it back anymore. Let it go, let it go. Turn my back and slam the door. And here I stand, and here I stay. Let it go, let it go. Cold never bothered me anyway. It's funny how some distance makes everything seem small. And the fears that once controlled me can't get to me at all. Up here in the cold thin air, I finally can breathe. I know I left a life behind, but I'm too relieved to grieve. Let it go, let it go. Can't hold it back anymore. Let it go, let it go. Turn my back and slam the door. And here I stand, and here I'll stay. Let it go, let it go. The cold never bothered me anyway. Standing frozen in the life I've chosen. You won't find me. The past is so behind me, buried in the snow. Go, let it go. Can't hold it back anymore. Let it go, let it go. Turn my back and slam the door. And here I stand, and here I'll stay. Let it go, let it go. The cold never bothered me anyway.
Love it. I was getting fired up listening to Rachel Rizzuti sing Let It Go. That's such a awesome, powerful word for us because we hold on to so much stuff and so much anxiety. If we let it go to the Lord, we have so much more peace and freedom. So definitely check out her website. It's rachelrizzutimusic.com. And we encourage you to continue calling in. That number is at the bottom of your screen. It's 244-1616 because we're talking with our wonderful guest, Dr. Monroe, and we'll take your questions if you have them for us. And for Dr. Monroe, he's got his practice right here in the upstate in Greenville, South Carolina, and we highly recommend it. Personal friend of ours as well, and wonderful expert. We're talking on relationships, intimacy issues, and we're going to talk about some of the physical things as well. But I know we had a phone call that came in that was a wonderful blessing.
Absolutely. We did have a salvation this evening,
Amen.
and the person has requested not to have their name shared, but nonetheless, it is really great to hear that. Please continue to call in throughout the evening. And like I said, if you have a question for our medical expert, we'll do our best to get it answered to you here on air. Before we join Dr. Monroe again, I just want to caution anybody who's sitting in the audience and just joining us that, again, some of the things we're talking about this evening are anatomical references in that, and if you have young children in the room, you may not be comfortable with some of the things we're talking about, but we're trying to keep it adult and above board. But I do want to give you that warning, just in case you're dialing in, and this is not your typical Nightline show. But again, you know, Dr. Monroe, one of the things I know that you as a urologist do a lot of is the treatment of prostate cancer. And you were saying before we went to the break here with the music that in itself opens the door to just a myriad of issues that men face. Can you walk us through that just a little bit?
Yeah. Prostate gland is a gland that men have. It basically sits below the bladder. The urethra goes through the middle of it, so in other words, you urinate through this prostate. The prostate, what it does, it contributes to semen formation, and it keeps infection basically out of the bladder. When you get older, it can cause some problems. You can have benign problems or non-cancerous problems and trouble urinating. It can swell, make it harder for you to urinate. Sometimes you get symptoms of frequent urination, getting up at night, or just having to strain, push real hard to urinate. We also treat prostate cancer, which is a different problem. Treatment for prostate cancer can occasionally cause some problems. One of the problems, as we've spoken, is erectile dysfunction. The nerves that there are nerves that go into the penis that tell the tissue to open up and blood will flow in. And those can be damaged with treatment for prostate cancer. So as a result, we have a lot of men who are older anyway, and they may have more erectile dysfunction as a result of that. So I would say that if there are any men who've had any kind of prostate issues and have trouble with their sexual function, it can be treated by a urologist. Another problem that prostate cancer, especially treatment, can cause is urinary incontinence or leakage of urine. And that you don't have to live with that. I always say that any kind of incontinence, whether it's male or female, leakage of urine is not normal and can usually be treated, sometimes just with medication. But I would urge anybody that has any of those problems to get a referral to a urologist.
And I like that you're saying that, because I know women, for example, especially after you have a baby, they'll say they'll when they cough, they'll urinate a little bit, or when they exercise.
Yeah.
But a lot of my friends who I know who have that, they're embarrassed to talk about it, and so, but you're saying it's not normal and it's actually easily fixed, and that's encouraging to hear. It's not this tremendous procedure that's so expensive or so dramatic.
Right, and the time I see that a lot of times is when the child gets old enough to run out in the street, the mother has to chase him and she leaks urine then. So it definitely can occur after multiple or just one childbirth. A lot of times it'll get better with exercise, or there are exercises you can do, or physical therapy to fix it, or medication. But if you have stress incontinence, which is leakage with activity, coughing, exercise, sneezing.
Swinging a golf club, something like that.
Aerobics, that kind of thing. That can sometimes be fixed with what they call a urethropexy, which there are several ways to do it, but one way can be done just as an outpatient. Go home and then you rest for, don't do anything really strenuous for several weeks, and then you should be pretty much cured.
That's very simple. And another thing too, like sometimes you think with prostate cancer, like I guess if you're talking about if they get damaged after radiation, maybe you're
correct.
Chemo.
Surgery or radiation can damage.
They might think that that's their lot in life. Like, well, I don't have cancer anymore,
right.
but this is the way it is, and that's not the way it is.
We can, we see men who have severe incontinence. We call it the pads that you have to wear to collect urine in, and they go through numerous ones, and that's a severe case. Sometimes that needs a procedure called an artificial urinary sphincter, which is a device that compresses the urethra, and you have to have a little pump that you squeeze under the skin in order to void. But it sure does beat wearing 10 pads a day.
Of course.
We were speaking earlier as far as incontinence. It really is sort of a social cancer, I guess. When people have really bad trouble, they don't want to leave the house. And when you stay home, it affects you mentally and emotionally.
Oh, of course.
So it can hurt you.
Well, an amazing statistic that when I first started dealing with this was the fact that more adult diapers are sold in the United States than pediatric diapers.
Really?
And that floored me.
And they're very
shocking to me.
expensive too.
Yeah.
Yeah.
Yeah, well, I know the pediatric diapers just about broke me. It was like, I couldn't wait to get that $60 a month back. And I mean, you know, and a child's urinary output is nowhere near what an adult male or adult female is going to be. But it is heartbreaking. And Tanya was, you know, she was mentioning it. You're right. These people become recluses into their own home. I remember we were attending a church service, ironically, and got seated next to a gentleman who clearly had urinary incontinence.
Right.
And it was, the smell was so powerful by the end of the service that you could tell his wife was embarrassed, he was embarrassed, and people had started moving away from him.
Right, and that is a very large part of our practice, and we're used to that. There's no reason to be embarrassed. You know, any urologist, most urologists treat incontinence, I would say.
I think that's a good that we're talking about it, because the whole point is there's no reason to be embarrassed about any of this anyway.
Yeah.
I mean, you know, I know it's uncomfortable and awkward, and like we had said, you don't really talk about this in church and you know, with your friends, but you do need to find a doctor that is trustworthy. You can go in and just be honest. And that brings me back to even about, like we were talking about before, the music. On your website, you're talking about lifestyle choices. You need to be honest with your doctor about your lifestyle choices, because this impacts your health greatly.
Yeah, you were speaking earlier about several things. Inactivity, obesity, smoking is a big problem. You know, we're actually, I think, seeing less incidence of smoking, but smoking can be tied to erectile dysfunction, which we got back to earlier. It's hard. I wish they could go into every high school and talk to all the boys and say, listen, if you keep smoking, you won't be able to get an erection one day. They would look at you like you were crazy.
Cigarettes in the trash can.
They would fill the dumpster with cigarettes.
Yeah, that's what I'm thinking.
But that is true. And it's hard to believe when you're in your 20s or your 30s that anything can slow you down, but the cigarettes will be the first sign.
I was amazed at some of the things that do contribute to some things you wouldn't think about. Like, it's almost unheard of for people, unless it's hereditary, to have bladder cancer unless they're smokers. That was one that really amazed me.
Most common cause of bladder cancer is exposure to cigarette smoke. We see a lot of women who maybe didn't smoke, but their husband did, and secondhand smoke can even cause bladder cancer.
Wow.
So the distant second is chemicals. Some used in the textile industry, like dyes and stuff like that, but the majority is cigarettes.
But the few times I've seen people who've been treated for it, it's not a fun way to be treated for bladder cancer.
No, it's not. It's a deadly cancer. It can be deadly. So it's and the symptoms of. Here's another thing to look out for. If you have blood in your urine, if you urinate and it looks bloody, it's never normal. Right. A lot of times it's not cancer, it's something else.
And I think that's what keeps people out of the doctor's office, is that fear that it's the big C.
Right.
You know, you and I know that what BPH is. It's benign prostatic enlargement.
Right.
But, you know, we're in the 50s and 60s, you start to see your urine stream slow down, and these guys get really nervous, and they're like, well, I don't want to go in and find out I have, you know, cancer.
Interestingly, the urinary symptoms in a male, as far as what you've just spoken about, weak stream, that usually does not mean you have cancer. Prostate cancer usually is asymptomatic. So I think if you're having a lot of problems urinating, that you need to just talk to the doctor. A lot of times medicine can fix that as well. We always like to start out with the least invasive thing, but we'll go full throttle and and go to surgery if you need to.
Right.
So.
I think there's been a lot of advances too, and I know you guys are on the cutting edge over there as far as robotic surgery. And it just like the incontinence procedures, particularly for women, used to be big box surgeries, prostatectomies have changed a lot too. Could you share a little bit about that?
Yeah, prostatectomies, what you do, you remove the prostate and you have to sew the bladder back to the urethra, and that most of the time in the past is done through a lower incision below the belly button in the man. And laparoscopic surgery is very popular now. Probably the majority of them are done laparoscopically, which means going through a small incision, like at the belly button. At St. Francis Hospital, and most hospitals have a Da Vinci robot now. And we have a couple of urologists in my group that do those. And it's basically about a 24-hour hospital stay, smaller incisions, and less pain. So it is, and it's a good way to cure cancer too. So, and our results are pretty good as far as the incontinence and the impotence aspect of it. But that's something to talk to your doctor, your surgeon about. But I think we have those here in Greenville. Greenville has a good medical community. We have I'd say 99.9% of what you might need with any kind of condition can be offered here in Greenville. So.
And that does bring me to a point. I know a lot of times, because I've gone to teaching institutions to cover cases, and that there's a lot of things that people will go to a major teaching institution when in fact the community-based physicians who are in your local area are every bit as equipped to handle and treat, and in some cases see more of than actually the teaching institutions.
Well, I think we need both. I think we need community and the teaching, because there's so many patients now, and there's actually a little doctor shortage. But you're right. I mean, I came to Greenville over 20 years ago and was really impressed by the quality of the medical community here in Greenville. I think it's you can get it depends on the volume of surgery. If you ever talk to a surgeon, ask him how many surgeries he's done in this particular field, and that'll give you an indication about how the results are going to be.
It seems too like it's probably difficult, because if you do get treated, say you hop in your car and you drive up to North Carolina, and then you come back to Greenville and you have a complication. You're in the ER. You're now dealing with physicians who may be capable in that, but don't necessarily know your medical history. Now have to get on the phone and call up and find out what's going on. Would you say that's something to be concerned about?
It just depends on the patient. Some patients don't mind going somewhere. Some doctors, I've referred people to other places as well. But it is nice in a lot of ways to be local. So if you have problems with your doctor, you can get taken care of.
Excellent.
Excellent. You have been enjoying Dr. Monroe, and we've got more with him in a minute. And right now we're going to be listening to music with Rachel Rizzuti, and she is singing The Lion Roars.
My
You're enjoying music from Rachel Rizzuti from her CD, and she was singing The Lion Roars. And one of the things I love about her CD, and we shared this in the first hour, she's got this insert inside and has all the words to all of her songs. So when you get her CD at rachelrizzutimusic.com, you can pull this out and you can sing along with her and worship the Lord, and we know that you'll be blessed. And you're also enjoying in this hour our wonderful expert tonight, Dr. Bob Monroe from Greenville Urology here in Greenville, South Carolina. And if you go to his website, it's Greenville and then a hyphen urology.com. You can check him out and learn more. He's got so much information on his website. One of the things that resounded with me, Dr. Monroe, that you had said in the last segment was you mentioned fear. And Rick and I see in our ministry, in our organization, so many people live their life in fear.
That's right.
You know, fear of the unknown, fear of things. I mean, even there were things that came in my life because my mother is a 5-time cancer survivor and 2 times was breast cancer. And so there was like, is that going to happen to me? And I think by talking with you, what's encouraging to hear is that if you will step out of that fear, out of your comfort zone maybe, and go and address these things, often there are therapies and there's ways to be taken care of that are not very invasive, not very expensive, and you can live such a much more fulfilled and healthy life by addressing these issues.
Right. You're right. I think we see that a lot. People just sort of get in the habit of living with what they have.
Yeah.
And it's something that sometimes you just got to take the
Absolutely.
take the bull by the horn.
Yeah.
So, anyway.
I love that.
Well, you know, and it's interesting too because like you and I were talking about, it's funny because I was looking through some of the prayer requests this evening and we've gotten somewhere around 90 of them now. And I was amazed at how many of them had to do with hypertension. And a few of them with diabetes. And I thought, how interesting, because I know I read the patient's charts before the cases so that I'm as up to date as I can be before we go into the case. And I'm often struck by, it used to be when I first started doing this 10 years ago, that there was a lot of prostatectomy guys and guys who had had some type of injury there. But now it's more, you're seeing a lot of hypertension and a lot of diabetes that are affecting particularly erectile dysfunction. Do you see that a lot in your practice?
I see it, and people who have overt or obvious diabetes, and there are a lot of people that are walking around borderline diabetes probably don't know they have it. And you know, the way to prevent, we're talking about type 2 diabetes, not the kind that you can get when you're a child, but the kind that hits you as an adult. And that is a very lifestyle dependent. And you know, you've got to watch the obesity, the fat around the middle. It's very, you've got to exercise, right diet, probably get away from the carbs.
Right.
But that can cause erectile dysfunction. You're exactly right, and it damages the vascular layer in the penis. And I mean, we put implants in people all the time, penile implants in people that have had long-standing diabetes. So I think diabetes in the future, they're going to say it increases your chance of cancer, dementia, you know, all these other things.
And I think what's interesting, I know we've got some things here that you were going to show us, devices from American Medical Systems, implants that you use on patients once that tissue has been damaged. When a person thinks, oh, this can't be restored, yes, there are many options. There are many things that can be restored with.
I agree, and I mean, how many times have we both seen like patient education seminars where people go, I've been living with this for 20 years and nobody told me that there was a treatment for the particular disorder that I face.
Right. Now, it's we mentioned earlier the severe male incontinence, and I don't know if you want me to.
Yeah, absolutely. Show us what we have here.
Artificial urinary sphincter. A sphincter muscle is the muscle that keeps you from urinating, and if it's damaged by surgery or radiation, there's a little cuff.
And I think they're actually picking it up on one of these cameras here for you.
That'll go, see, right there.
This
There you
one
go.
here.
There you go.
Yeah,
Okay.
you-
Yeah, it'll go around the urethra and it tightens up. This is all internal, none of this is exposed. And it keeps you from wetting until you feel like you need to urinate. And a man will typically, I mean, everybody knows how men urinate. He'll be standing there, and this will be under the skin, usually in the scrotum. And all he's got to do is squeeze that a couple of times, and it opens up and lets him urinate. And then after about 90 seconds, it'll close back down again. So it really takes an operation to do this. It's about one night in the hospital. But it's a very good, people don't want to have an operation a lot of times, but this is for severe incontinence.
But that would eliminate all of the diapers that you're talking about and all of the, right, and the fear of leaving the house and those types of things.
Yeah, mostly. I mean, if you can get somebody from 10 diapers down to maybe 1 or less a day, they consider
Amazing.
that
A radical
Oh my
life change.
goodness, life-changing.
You know, I've had men give me a hug for that, which you usually don't see. But
Well, I think it's important too to point out that some patients may not need a necessarily artificial sphincter. I know the lifespan on those is anywhere from 10 to 20 years, you know, for that particular device. But there's also a newer procedure for men. I say newer, maybe 4 or 5 years. That's actually something very similar to what females get. And
right, well, for a long time we've treated stress incontinence in women with what they call slings. Very effective for women. Male sling is introduced a few years ago. This plastic part does not stay, but it's just a sort of a saddle for the male urethra to support it. The advantage of this is there's no pump. You don't have to pump anything to urinate. It just supports. And the difference is the degree of incontinence. This is more for moderate incontinence, and the artificial sphincter was more for severe incontinence. So most people don't need any surgery, but we can handle any degree of incontinence usually that comes around.
And I think, you know, like you said, the change in somebody's lifestyle based on that is just immense, and it doesn't interfere with their ability to be intimate. Another one of the things that we have on the table here is actually the penile implant, and this is an interesting device if you've never seen it as well, in that it's composed primarily of a reservoir that fits behind the pubic bone that's surgically implanted, as well as the 2 cylinders and the pump here. And the interesting thing about this pump is that what it does is when this reservoir is pumped, it will actually allow there to be a stiffening effect that is here. And if you could speak a little bit about, you know, some of the limitations of this device and also some of the patient expectations of this device.
Yeah, usually people who get a penile implant, it's an inflatable penile implant, have gone through all the other options for their erections. I mean, they've gone through pills, shots, and nothing else works. This requires an operation to do. It's usually about 1 night in the hospital. You have to sort of rest for about a month until you can use it. None of this is exposed. This is all internal. And the advantage of this type, the inflatable one, was when the man is not interested in having an erection, he has a normal, non-erect penis there. This is all inside, and then when he wants to use it, doesn't matter if he's tired or whatever, it'll work. It pumps up. Now the limitations are, well, the good things are you can have normal sensation, as a man should when he has intercourse. You can have an orgasm. The disadvantages are it takes surgery. There's a small risk of infection. It is an implantable device. There's a small risk of maybe shortening the penis a small amount compared to what he was when he was maybe younger. But it is, most men, I believe that I've read that the penile implant has the highest satisfaction rate compared to any other treatment for erectile dysfunction. Usually because the men, I hate to say the word desperate, but they've gotten to the end of the road.
Yeah.
They've
tried everything.
Want to have
What, I mean, what an
done.
option, especially if you're saying you haven't lost sensation. So this is not like, you know, you're never going to feel it anyway, so what's the point? I mean, if you can feel sensation and feel normal, and that
I
part
always
of your...
tell the guys, don't expect to go out and just suddenly be 25 again.
Right.
The most important thing is what we call foreplay. That is still necessary, even with a penile implant.
Right. But that goes back to relationships. That's important
Correct.
for relationships and that intimacy anyway.
And this won't solve marital problems. And I think, you know, I know you and a lot of the physicians, you say there's 2 expectations. That number one, it is not going to make you more gifted than you were. And the second one is this is not going to solve your problems.
Some men actually think that they come in, they go, I've always not been well endowed and I want you to make me larger than I was, and that's not what this is.
Right.
This is, I don't know what that is, but we don't do that. But
Have that kind of surgery.
this is just to get you functional again.
Exactly.
And so that's what that's about.
But
Yeah.
do you see that? Have you seen patients come back and actually seen that renewal in their relationship? And
I have, yeah, and these have a lifespan. I mean, they can wear out like a car or tire or whatever, but usually it's in terms of 15, 20 years or something like that. I mean,
that's a long
at least
time.
10.
Right.
And they might have to be replaced, which is a fairly simple operation. So, yeah, we see guys that like these as well. They're good.
well, we want to close out this hour. I can't believe it's been that much, but just reminding folks where they can find you. Your website again is
Greenville-urology.com.
excellent. And again, that's Palmetto Greenville Urology, and this is Dr. Bob Monroe. And again, like I said, I don't think you're going to find a more qualified physician to treat this type of symptom or this type of illness, if you will, in the upstate. Like I said, he was a great physician for my father, and I really, truly appreciate him coming on this evening and talking
Yes,
about a
thank you.
sensitive subject
Right.
that has to be addressed.
Yes, thank you.
Thanks.
Yeah.
It's
And you
a
definitely,
pleasure to be here.
Yes, you too. Definitely check out our Facebook page under Boundless Limits, because there you're going to find a picture that we took with Dr. Monroe before the show started, and we're going to have all of his website information. We know how busy you are. We know we've had other wonderful guests, and so we love to put all of that information right there for you so that you connect with him. They also are on Facebook, so you can click like on their page, and then definitely check out his website at greenville-urology.com.
Absolutely. Remember, God is the healer, but the way He heals a lot of people is through the hands of very skilled physicians like Dr. Monroe. And God did not put you on this earth to be miserable with incontinence or erectile dysfunction or anything, hypertension, diabetes. He does have ways out there that you can be treated. But the point tonight was to just remind you that these things can help fix your relationships, but you ultimately have to have God in your relationship.
Amen.
Well,
Well, God bless you. We look forward to seeing you here on Nite Line again. Take care.